Okay, welcome everyone to our Hump Day Health session for Sexual Health Week. My name is Caitlin Atherton and I work in health promotion and workforce development for WAAC. So thank you so much for joining me today and we'll get started. So just before we begin, I'd like to begin by acknowledging the first and true custodians of the land on which we are meeting today, the WAAC people of the Noongar Nation. And I'd like to pay my respects to Aboriginal and Torres Strait Islander cultures and their elders past, present and emerging. I'd also like to recognise their immutable strength and resilience, always was, always will be Aboriginal land. Okie dokie, so who are we? We are WAAC, previously the WA AIDS Council. We were founded in 1985 as a grassroots organisation in response to the AIDS crisis. We are actually celebrating our 40th birthday this year, which is pretty awesome. So the landscape has definitely changed since then, and our aims have expanded to focus on HIV, STIs, and sexual health in WA. So we work within a harm reduction and a harm minimisation framework, and that's through our health promotion work. So we provide a diverse range of services across the organisation. So our original focus was to provide support for people living with HIV, which has expanded significantly into what we would identify now as our allied health team, as you can see on this slide. So they're a dedicated team to support people living with HIV. And they do that through counselling, case management, peer support, workshops and forums, and also social spaces like art therapy. So I work within our health promotion team. And we focus on sexual health education. So we do a lot of educational workshops for schools, universities, other organisations that request us. We also co-design sexual health interventions like campaigns. We recently had a big syphilis campaign as syphilis was on the rise. And we also hand out a lot of free condoms. So we do a lot of safe sex packing. And we hand out a majority of our condoms to Duns relievers. So we go down to leaders and do a week of education and harm minimisation down there as well. I also work across our workforce development team, and we pretty much provide trainings on HIV, STIs and BBVs, LGBTIQA plus inclusion, sex positivity and harm reduction. So very similar to the webinar that we're doing today. So yeah, I think that's pretty much everything on WAAC. Basically, we just believe that everyone can have positive sexual health, and our main population that we target is the general population and young people as well. So yeah, let's move on to why we are here today. So Sexual Health Week is running from Sunday the 9th to Saturday the 15th of Feb. And this year our theme is Celebrate Change. So Sexual Health Week is a week-long celebration focusing on awareness and just shining a spotlight on sexual health. So our theme, Celebrate Change, is pretty much to recognise all the progress that we've made in fighting stigma, improving access to services and also addressing systemic issues that occur due to stigma and other things in terms of sexual health. Yeah, it's just to highlight success of community-led responses to HIV and STIs. And the main points that we're trying to get across this week is bringing awareness, educating and reducing stigma around sexual health. So it's really awesome to note that we have made massive progress in terms of advocacy, peer support, education and systemic issues. So now that so many more people have access to important services that they need in terms of their health. And yeah, we've kind of improved health equity across the board. We recognise all the past changes that have led us to get where we are and like to celebrating our 40th birthday, which is pretty awesome. And it's really nice that our theme this year for Sexual Health Week coincides with our 40th birthday because we have come such a long way. So yeah, it's very important to reflect on the work that we do and the work that everyone does in the industry. And the massive impact that it is having on the community because we've come such a long way and the HIV and sexual health landscape has changed exponentially. So we just wanted to take a moment to pause and reflect on this throughout the week and just provide a little bit more education on sexual health. Okie dokie. So what are we doing this week? We are running a few webinars just like the one today. We also have posters that are being distributed. So let us know if you would love a poster. You can also change your email signature just by scanning the QR code, and that'll take you straight to our Sexual Health Week website. And you can find those email signatures on there and copy and paste them into your email. We also have a lot of social content going on. So our gorgeous health promotion team are going into the city and doing a few cute little interviews with a mini microphone and just asking people what comes to mind when we talk about sexual health and what's important to them in terms of their sexual health. We're also doing lots of content in terms of signs with little sexual health messaging, just prompting people to think about their sexual health. And as you can see in this photo here, our gorgeous Steph is modeling one of our signs. So that one is Google U equals U. So we're prompting people to jump online, look up what U equals U means. And it actually means undetectable equals untransmissible. So the great thing about the country that we live in is that we've made so much progress in terms of antiretroviral medication for people living with HIV. And when that is taken consistently and properly, people living with HIV can actually have their viral load lower so much that they actually become undetectable and therefore cannot transmit HIV to another person, which is really, really awesome. And once again, it's just like something fantastic that we can celebrate this week in terms of how far we've come in terms of health and, enabling people to live like full and healthy lifestyles. We also have our Safe Sex Packing Party, which is today, Wednesday, 12th of Feb at Brewdog from 4:30 p.m. So we actually hand out over 100,000 safer sex packs a year to the community. So we definitely need a lot of help packing them. So we'd love for people to come down, have a bit of a social chat with us tonight, pack some condoms with us, and just celebrate the Sexual Health Week theme. We will also be doing a community art installation that'll be at Fringe Festival this Friday for Valentine's Day. We'll be at the Pleasure Garden from 5 to 8. We'll have a stall and we'll be doing lots of fun games and little bits of education. And there'll be lots of prizes on offer as well for that. So please come and get involved. We've also got an art installation there where we're going to ask people sort of the really important sexual health moments in their life or what they want to know about sexual health. And the art installation is kind of in the style of like a protest scene. So everyone can write on like all the little signs that the people are holding up. And we can make a big kind of collection of like what sexual health means to the community. We've also been lucky enough to award some grants to WA regional areas. So of up to $1,000, we've been able to grant to people like Headspace in the north and south, WAAC, which is the WA Country Health Service, for example, because they're doing their own Sexual Health Week projects. And we've been lucky enough to facilitate grants for them, which is really, really awesome. Okie dokie. So sexual health promotion. What are the key sexual health messages right now? We just wanted to give you a little bit of an overview of the recent trends in terms of sexual health. What's new, what's hot, just so that you know what to keep in mind when sharing information with the community, educating, providing outreach, and making campaigns within your organisations. Alrighty, so let's start with sex positivity and harm reduction approaches. So sexual health is a state of physical, emotional and mental and social well-being related to sexuality. It's not merely the absence of disease, dysfunction or infirmity. Sexual health requires the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination and violence. So sex positivity. Obviously, sex is a normal human experience. It does not equate to having a lot of sex or encouraging others to do so. So what we really want to do is normalize sex, but still acknowledge that not everyone does it, but you can still be sex positive even without having sex. Sex and sexuality is experienced and expressed in different ways between individuals. So it's really good to just remember to always normalize sex, always be positive about it. when engaging with our community. So obviously I mentioned before that WAAC works within a harm reduction, harm minimisation framework. So it's really important to have a non-judgmental approach when talking about health broadly, not just sexual health, giving people the knowledge to make informed decisions about how they will reduce their risk. But yeah, definitely not telling people to stop doing what they're doing. It's about, providing people with that safety net and that information so that they know exactly what they're getting into, and how they can reduce risk and still have an enjoyable lifestyle. So things like negotiating consent, STI prevention, barrier methods will really contribute to people's overall sexual health, and the information that they know around that. Okay, so this one focuses a bit more on language. So obviously we use the term sexually transmitted infections over sexually transmitted diseases. STDs still has quite a negative connotation to it. So we focus more on using the term infection rather than disease. Also, an infection is passed on, which is how STIs occur. They're passed on, whereas they're not actually a disease. A disease may occur as a result of an untreated STI, but thankfully, most STIs are actually treatable and manageable, and they don't usually lead to death. So an example of that is HIV turning into AIDS. So HIV is the transmissible virus or infection, and that can turn into AIDS if it is left untreated for a long time, but they are not the same thing. And obviously just reminding people that, if you are having sex, there is a risk of transmitting an infection. Okey-dokey. Don't make assumptions. Once again, we're talking about language here again. So when it comes to sexual health, don't make assumptions. Language definitely matters here. We see this obviously in this example that I have on the screen here, men who have sex with men. So the label MSN is inclusive of people who don't identify as gay or bisexual, but still participate in that sexual behaviour of having sex with other men. So there's obviously a lot of stigma around sexuality and sexual behaviours associated with this terminology. So just to remember that in this specific context, the bottom line is to not make assumptions. So for example, if a patient came in and they wanted an STI test, and they tell you that they're heterosexual, don't discount them of having sex with men or outside of heterosexual relationships. So we always encourage an STI check, and positive conversations around sexual health as well. And this actually also comes into HIV prevention as well. We don't assume monogamous relationships. PrEP can actually be for anybody, and we really want to get that point across. So that includes those with partners who have sex outside of relationships. And it's just really important to be non-judgmental as well, because it causes a positive environment for discussion and support, and it actually reduces stigma as well. So yeah, if we are making assumptions quite readily, we may be missing out on people or cases. So yeah, if we're not using the right language and not asking the right questions, it can actually lead to further negative health outcomes. Okey-dokey, HIV does not equal AIDS. So historically, there's been a lot of negative stigma around the term AIDS, and it's just really important to get across to the community that HIV is not AIDS. They are actually very different things. So HIV stands for human immunodeficiency virus, human being that it can only be passed on from one human body to another. Immunodeficiency is what happens to our immune system. So our immune system keeps us healthy. So the virus actually depletes our immune system and virus. So that's sort of the type of infection that occurs. Acquired means, in terms of AIDS, acquired means it was not present at birth. Immune is our immune system that keeps us healthy. Deficiency means lacking or depleting, and syndrome is sort of the collection of symptoms and the characterizations of symptoms that occur when someone does have AIDS, and how we can kind of recognize what stage of the disease that they're in. So just to reiterate, HIV is passed on. That is what is transmitted from person to person. AIDS is not. AIDS is the last stage of HIV. In Australia, people actually may not get to the AIDS phase, just due to the effective treatment that we have in Australia through antiretroviral treatment. So HIV is not a death sentence anymore in Australia, or never was, but yeah, it's definitely not a death sentence. Unfortunately, it is a different story overseas, just because the landscape in other countries is different. Their healthcare system is not the same as ours. There's a lot of stigma, sometimes some cultural taboo and misinformation around HIV and AIDS. So it's good to remember that plenty of people travel to and from the US, from Australia. And so travel is a risk factor when it comes to HIV. We've seen quite a big decline in cases over Australia, and we had about 70 cases of HIV last year in WA. We're actually working towards virtual elimination of HIV. So yeah, which is pretty awesome. And anyone, even without Medicare, can access free treatment. Thank you. So we actually have a lot of new data that tells us more about the landscape around HIV. And as I said before, HIV notifications are going down in Western Australia. So we had about 70 last year, but it does mean that HIV still exists within Australia. And it's really important to sort of get that message across when talking to community, because we don't want to become complacent in terms of any STIs or BBBs. So it's really important to sort of pair what we've been talking about in terms of language and not making assumptions, and thinking that we don't need to use this information to understand how we can prevent new cases, because we can. That's really important, that we prevent new cases of HIV transmission and we don't become complacent, because we have come so far in terms of HIV and the help that we can provide, the health services that we can provide to people with HIV. So what was found from the data last year is that a large proportion of HIV notifications were among GBMSM, which stands for gay bisexual men who have sex with men, who are actually from COLD backgrounds, and COLD stands for culturally and linguistically diverse. So a large proportion of those HIV notifications were from people born overseas in regions such as Southeast Asia, Sub-Saharan Africa, and Latin America. And it's important to note here that other countries don't have healthcare systems that are as advanced or robust as ours. And so they may not have access to PrEP, which is a HIV prevention medication. There also might be stigma or cultural taboos around HIV and HIV transmission and prevention. So the understandings of sexuality, sexual health, and the way HIV is transmitted does have a role in driving transmission of HIV in other countries. So yeah, it's really important to remember when we're educating the community that people's perceptions can prevent them from accessing healthcare. So that's why it's so important to remember what language you're using, and also to be sex positive as well. And also just keep in mind culturally and with diversity, just to be trauma informed as well when you're speaking with members of the community about this. So on the graph that I did have, that I can't see anymore, I'm not quite sure why, it actually speaks to the health inequities that do overlap with HIV, and maybe I can pop it in the email that I send after this. I'll send a link to that so that everyone can have a look at that. So yeah, in 2014, the majority of cases were representing gay and bisexual men by birthplace. You'll see that it starts to go down from 2014 to 2016 when PrEP was introduced, which is pre-exposure prophylaxis. It's a HIV medication, and pleasingly it starts to go down, but we are seeing that in sort of the post-COVID era, even though it is going down, we're seeing the differences between Australian-born, Asian-born, and more broadly overseas-born as well. Those numbers, they're starting to actually become closer together because we know that travel is a risk, as I spoke about before, in terms of HIV transmission. And yeah, that kind of speaks more to the challenges within other countries of health access and that kind of thing. So yeah, health equities do exist in all countries, but we ask that we normalise this conversation around sexual health and HIV and ensure that this is something that's going to contribute to the change around people's equitable health access, especially with HIV. Okey-dokey. So STIs and BBVs can affect anybody. Yeah, so it's really important, once again, to normalise the conversation around STIs and BBVs because we know that they can happen to anybody, regardless of who you are if you're having sex. And it's really important to normalise and educate methods of prevention, including barrier methods. We do talk about condoms a lot, but we can also talk about things like dental dams. That's a type of barrier method. It's made of latex, it's very stretchy, very flexible, very easy to use. And it's used to prevent the transmission of symptoms of an STI or BBV through skin-to-skin contact. So yeah, if people are having sex or people's sexual partners are engaging in sex with someone who doesn't have a penis, maybe it's two people with vulvas, they can actually use something like a dental dam. It's really great for oral sex, but you can only use it once. So yeah, remember not to flip it over because you are actually potentially exposing yourself to the infection if you flip it over. So just remember that it's disposable and it's one use. But yeah, they are very accessible and really, really great. So it's just like an example of the many options that are available when it comes to prevention. So normalising the different kind of sexual behaviours and that there are prevention mechanisms for everyone and those kind of behaviours. So that's pretty key. We also recognise that social determinants affect the risk of negative health outcomes, which we've spoken a lot about through the whole webinar, but it's just something that's really important to remember. So things like healthcare system and in the structure of healthcare systems, stigma and taboo do affect people's sexual health behaviour. And herpes is on the rise. So a lot of people have oral herpes, as we know, as it's very common. However, people can potentially contract genital herpes as well. Yeah, it's on the rise again, so it's very key to take this opportunity to educate about barrier methods and the ways to prevent herpes through skin-to-skin transmission. We do know that herpes is the one where people often get a cold sore on their mouth or inside their mouth or their nose. So there are really great barrier methods to help prevent this. But of course, if someone does get herpes or another STI, almost all of them are treatable or manageable. So in the case of herpes and HIV, they'll stay in the body, but can be managed with effective medication, and people can live happy and healthy lives with this medication, which is really, really awesome. And once again, reiterating, celebrating the change that we've made in terms of health equity and access, and how fantastic our healthcare system is, and how far we've come in terms of sexual health and STIs and BBVs. So yeah, it's just very important to educate on all kinds of barrier methods, including condoms, dams, gloves as well is a really great barrier method, especially for oral sex in terms of herpes especially. Okay, so PrEP is for everyone. PrEP is pre-exposure prophylaxis, which is a medication used to prevent HIV. It's a very common misconception that PrEP is only for men who have sex with men. This is not true. We actually know that HIV affects anybody regardless of their sexuality. So women can have PrEP too. PrEP is effective. So it's very important to educate people on. It was introduced in 2016 and cases have significantly reduced in terms of HIV transmission since 2016, which is awesome to see. Anyone who tests negative to HIV can take PrEP, including women. However, it must be discussed with a health professional to determine what regime is best for that person, as the medication does affect people differently. If we assume only men can have PrEP, we're missing out on women who may be having sex with other people, for example, in terms of heterosexual relationships. People who are having sex outside of that heterosexual relationship, we could be missing them when they actually have just as much right to access the medication as anybody else. Okie dokie. Mpox. We are currently experiencing a global outbreak of Mpox. There has been an increase in local transmissions in Australia. So Mpox, which used to be called monkeypox, it is a virus passed on through skin-to-skin contact. So symptoms usually start within 5 days to about 3 weeks of exposure. And they commonly present as sores, rashes, bumps and pimples, sometimes fever and chills and muscle aches. So those very common symptoms can be missed because they are quite common to a lot of different infections and a lot of different illnesses. So they can be very easily missed. So it's highly recommended that you talk about Mpox and test for it as part of an overall sexual health check when you're going to get your test for your STIs. There's a lot of stigma related to the term monkeypox, which is why they've changed it to Mpox. And it's very easily preventable. There's only 2 vaccinations needed for it. And we actually provide them at our M clinic, which is pretty awesome. Okay, I think that's all I want to say on that one. And then I think we will move on to wrap up. So here's a slide just about all of our different supports. So we've got our little blue M for our M clinic, sexual health quarters, unintended pregnancy helpline. We've also got PAN, Health Equity Matters as well. So our Australian STI management guidelines, it's information about how to support patients with STIs for clinicians. So that's a great one when it does come to seeing a client about an STI test. PAN, which is PrEP Access Now. So it's Australian-based resources for where to buy PrEP and how to use it. And also just more information around HIV. Health Equity Matters is the National Federation for HIV organisations in Australia, and they have some really awesome resources like HIV in Australia, and they actually make a summary document of everything that's happened within HIV and health in the last year. So that's really handy to have. And then we've got our little WAAC symbol as well. Alrighty, so thank you so much for joining me today. We'd really appreciate your feedback. So if you could please scan the QR code and tell us how we went. You can also tell us a little bit more about what you're interested in seeing or how we can change these Hump Day Health webinars in the future, and sort of what other topics you'd love for us to chat about. I'm pretty sure our next one will be in about a month, and I'm pretty sure it focuses on recognising National Day of Women Living with HIV. And so one of our lovely health promotion employees, Amy, will be chatting to Diane. So it'll be a fantastic little interview. So I really recommend jumping on and listening to that one. And we also have got a youth week one coming up, and we also have a men's health week coming up soon as well. So please stay tuned for that. And thank you again. That takes us to the end.